Good evening, Berkeley. I'm your Mayor, Jesse Adeguin, and thank you for joining us for the special virtual town hall meeting on the City of Berkeley's response to the COVID-19 pandemic. We decided to schedule this town hall. Normally, we have these every 2 weeks, but given the announcement last week of a statewide and local stay-at-home order, we felt it was important to provide information to the Berkeley community on that stay-at-home order and also to answer your questions directly. We've received a number of questions from Berkeley residents. We look forward to addressing those later on in the town hall meeting. As you all know, last Thursday, the governor announced a statewide stay-at-home order, which will take effect if counties reach an ICU capacity of 15% beds available. Thanks to the leadership of our public health officer and health officers in 5 counties, the Bay Area is once again taking the extra and I think necessary step of putting in place public health precautions to help protect our communities and to ensure that we have adequate ICU capacity. And so Friday, the City of Berkeley and 5 counties announced that they will be participating in the statewide stay-at-home order in order to maintain an adequate ICU bed capacity in our respective counties. Dr. Hernandez will address the current number of cases in Berkeley and in Alameda County, as well as the current ICU capacity during her remarks. We are, sadly, but expectedly seeing an increase in cases in Berkeley, in Alameda County, and throughout the country. And the increase in cases and the decreasing ICU capacity is deeply concerning. So we look forward to addressing your questions. We received a number of questions regarding the Berkeley Unified School District and their timeline and decision-making on reopening. And so we will be scheduling a separate town hall meeting with Superintendent Brent Stevens and hopefully other school district participation in order to answer those questions directly about BOSD's decision-making and reopening and their timeline. We know that a vaccine is on the horizon for frontline medical personnel, hopefully this month, and for the broader public next year. But we need to get through this next month. And there is light at the end of the tunnel. And so we really call on the Berkeley community to follow the stay-at-home order. This is necessary to help keep our community safe, to get us through this difficult next month or two until a vaccine will be widely available in order to protect our community. So I share the concern that I think many Berkeley residents have expressed around not just the increasing number of cases, but the impact that this has on our community. I want to particularly acknowledge the impact this has on our businesses, some of whom are seeing additional restrictions being put in place. And I want to just acknowledge that the city and the county are taking steps to provide additional resources for our businesses. The county launched a CARES Act fund, and a number of Berkeley businesses have applied for that funding. And the city of Berkeley provided $200,000, which will be matched by the county, for a total of $400,000 in additional funds to support our small businesses in the city of Berkeley. Lastly, we have relaunched the Berkeley Relief Fund, and we call on the Berkeley community as part of your decision about holiday giving to please give once again to the Berkeley Relief Fund so we can provide essential economic support for our small businesses, our arts nonprofits, and our residential tenants who are hardest hit during this second wave of infections this holiday season. So I want to thank our city leaders for joining us this evening, our health officer, Dr. Lisa Hernandez, the director of the Department of Health, Housing, and Community Services, Dr. Lisa Barhus, and our city manager, Dee Williams-Ridley. And with that, I'd like to turn the floor over to Dr. Hernandez. And Dr. Hernandez, you can provide us an update on the number of cases in Berkeley as of today, as well about the ICU capacity in Alameda County, because that's an important metric that we are trying to meet as part of the statewide stay-at-home order.
Good evening, Mr. Mayor. Thank you very much for allowing us to have this opportunity to speak with the community, answer questions, and really give a firsthand understanding of what's going on in terms of the data. I am going to do a little quick presentation on the data that I see every day. It's a little prettier than what I see every day, so that people can understand it easier, but I will talk about that in a second. But I will start as usual with the numbers, first with county level and then drilling down to our city. So for Alameda County, and this is not including our numbers, we now have 33,469 confirmed cases with 524 deaths. When we look at the state indicators, and then for hospitalizations, we are now at 254 people hospitalized currently. That's the highest it's been during the pandemic. In terms of ICU, admissions now at 69 currently in our ICUs. That is at the same number as a peak in the summertime. So those two days, today and in summer, tie for the highest during the pandemic. So we are seeing both hospitalizations and ICU continue to rise in the county. When we look at the case rates, which is the indicators that the state uses to look at current amount of disease in the state, in the region and in the county, case rate unadjusted for Alameda County, and this was given to us earlier this week, is at 17 cases per 100,000, and that's a 7-day average with a 7-day lag. So this is a week old data. Also, our test positivity at the county level is at 4.9%. Again, that's lagged by a week. And when speaking to the Alameda County health officer earlier today, he reported that the case rate now is almost doubled. So it's closer to about 30 or a little more cases per day per 100,000 at the county level. When we look at City of Berkeley cases, we are now at 1,412 confirmed cases. That's an increase of 254 cases from 10 days ago when we reported here on the town hall. We're averaging about 26 cases a day. Again, that's a doubling from what I believe I reported about 10 days ago. Our deaths fortunately remain at 9. And that's not a change, but we also are seeing increase in hospitalizations of our City of Berkeley residents. And I worry that we will see increase in our changes in our death count. We continue to provide sufficient testing to our community. In terms of tests per day, we're now at over 1,200 tests per day. Our percent positive, which is the percent positive is the number of tests that come back positive. Cumulative is at 1.2%. That's a rise from my last report. And then I want to talk a little bit about the state indicators very briefly. For us, we calculate our own state indicators because the state calculates these at the county level. But we do this internally, and our current case rate is at 19 cases per 100,000, 19 cases per day per 100,000, and our test positivity is at 3.4%. So that's currently, and we're seeing both the case rate and our test positivity continue to rise. I will talk about ICU capacity. And then I want to talk about why is this continuing to be concerning. So as the mayor mentioned, we have a new stay-at-home order issued by the state, and they're using adult ICU capacity as the indicator for placing regions into this stay-at-home order. And the capacity trigger is when it's when there's 15% or less bed capacity remaining in the intensive care units for the region as a whole. And I just want to share with you California's current ICU capacity overall is at 9.9%. The Bay Area's capacity now is at 17.8%. And I just want to tell you what the Bay Area encompasses, what the region, that includes the counties of Alameda, Contra Costa, Marin, Monterey, Napa, San Francisco, San Mateo, Santa Clara, Santa Cruz, Solano, and Sonoma. So as mentioned, as a whole region, we're at 17.8%. You can see this information on our webpage, on the state's webpage at covid19.ca.gov/stay home except for essential needs /pound regional stay-at-home order. And there's data there that they're updating showing the capacity of all the regions as well as the state capacity and also FAQs on the stay-at-home order. Just want to let you know our 17.8% is a drop of 3% since yesterday. So we're not moving in the right direction as a region and as a state in terms of our ICU capacity. Alameda County has about 30% ICU capacity. It's a bit more than our neighboring counties, but that capacity also is dropping as well. Our hospitals are still safe and prepared. And that is one of the reasons why we issued this stay-at-home order early, because we wanted to protect our capacity in our ICU and not issue the order too late. If I can, I'd like to share my screen and hopefully do a decent job with showing the data. Let's see what I can do. So hopefully you can, this is a PowerPoint. So let me see if I can get it to the PowerPoint. So Mr. Mayor, do you see the PowerPoint slide?
Yes.
Great. So this is, let me start with our statewide cases. This shows basically our cases for COVID-19 by date since the beginning of the pandemic for California. And it shows, as you can see with the dark blue line, our cumulative confirmed cases, and you can see the different peaks of our cases. You see the one in July, and then you see where we are now in starting in November and into December. You can see that our peak for the state is higher than it has been. You can see that the rise is more acute than it had been in the past. So I just wanted to show you that and then move to the next graph, which shows statewide hospitalizations, and just orienting you a bit. The lighter orange is confirmed non-ICU hospitalizations, so people that are in regular hospital beds. And the darker orange is our confirmed ICU hospitalizations for the state. Again, just showing you the rises that you see, the surges. You see one in April, mid-April to early May. And then you see again in the summer surge that you see for both ICU and for hospital, and then you move over to where we are right now in November. And again, this is statewide hospitalizations. We then go to Alameda County and looking at our cases there. Again, we see the same sort of trend in terms of the summer surge in July, August, and then our cases in November as well. Again, same pattern for Alameda County in terms of hospitalizations and ICU, with that same summer surge here in the middle, and then our spiking for hospitalizations and ICU admissions. And then I want to talk about City of Berkeley. So here We do see some of the same behavior here, but I want to focus mostly on what we're seeing recently in terms of our numbers. We're 2 colors that you see for our daily reported cases. One is the blue, which is non-Golden Gate fields, and then the orange, which is Golden Gate fields. As mentioned, and I'll talk a little bit about the Golden Gate fields outbreak. We are continuing to work with the Golden Gate field community, but I also want to make sure people are aware that while early in November to mid-November, we were seeing our activity be attributed mostly to Golden Gate fields, but as you see, we are seeing continued peaks after the numbers have lowered in the Golden Gate field community, and we continue to see spikes, and the spikes are higher, especially if you see here this orange vertical line shows where Thanksgiving is, and then you see the post-Thanksgiving surge. And this is mostly blue, which means it's non-Golden Gate field cases. And you also see that this spike, besides Golden Gate fields, this is the highest spike we've seen throughout the pandemic here in the city due to City of Berkeley residents. And then you can see the activity of our cases without looking at Golden Gate field in terms of, again, the surges. You see before Thanksgiving, there were some cases here. And then you see Thanksgiving Day. And then you see this large spike here that still continues. Even the baseline that you're seeing here for our cases reported per day is much higher. So that's what we're worried about, is that had a surge before Thanksgiving, even before, without including Golden Gate fields. And then we're going to have a continued surge because of the holidays. So it's that surge on top of a surge. So I will stop sharing my screen and continue with my report. Hopefully you don't see any of my rest of my screen now. Okay, so as you mentioned, last Friday, we announced that we were issuing the stay-at-home order essentially earlier than the state would impose those restrictions on our jurisdictions. And we did that because of what we were seeing, some of what you've just seen in terms of the data that we look at in our jurisdictions, looking at the number of cases and knowing that after 2 to 3 weeks, we're going to see more hospitalizations. After the hospitalizations, we're going to see ICU, and then we're going to see people potentially succumb to this disease. When our ICU capacity is reached, we're going to see more impacts in terms of the health of the community. And this has been the worst that we've seen in our pandemic here in the state and of course nationally. So that's what we were looking at, and knowing that we had to take steps quickly. As mentioned, we've dropped 3% in our capacity as a region just from yesterday. So these numbers go quickly. Certain jurisdictions throughout the, certain regions throughout the state have less than 2% capacity for hospitalizations. Some hospitals don't have ICU capacity, and they're transferring patients throughout the state. So that's what we were trying to avoid. So what we did was we issued the order and essentially just impose the stay-at-home orders that the state would have imposed on us later on in our trajectory to try to curb the impact on our communities. And I can go through some of the restrictions. Basically, what we're seeing is a temporary closure, basically from December 7th to January 4th. Our hope is that we can stay home as much as possible. That's what we really need to do. And hopefully control this spread of the disease to a point where we can maintain and preserve our capacity in our hospitals so we can be able to save lives and continue to provide the care that we need to. So basically, that's what the goal is of this order. So there's temporary closure for outdoor dining. Only takeout and pickup and delivery is permitted. Indoor playgrounds are not, these are all the closures. So no indoor playgrounds, no indoor recreational facilities, hair salons, barbershops, personal care services, museums, zoos and aquariums, movie theaters, family entertainment centers, card rooms, satellite waging, limited services that are not included in critical infrastructure. And the best thing to do is to look at the website for the state to look at what's considered critical infrastructure, because there are some services that could fall into both limited services and also critical services. So if they're listed in critical services, they are allowed to continue to operate. And amusement parks, those are the sectors that are required to close. Certain sectors are allowed to continue to operate with modifications. And these are some of them. For example, outdoor recreational facilities are allowed without eating or drinking or alcohol sales. There are no, I don't think this applies to us here in the city, overnight stays at campground. Retail and shopping centers are permitted to operate at 20% capacity, except for standalone grocery stores, which now are able to operate at 35% capacity. And some of the other provisions in retail include entrance metering so that the capacity is monitored. And again, no eating or drinking in the stores. Also mandated is that there's special hours instituted for seniors and others with chronic conditions that put them at higher risk for complications and acquiring COVID-19. And then hotels and lodging can open for critical infrastructure support. Offices are still at remote only, except for critical infrastructure, so that, trying to promote and encouraging remote working as possible. Places of worship and political expression are allowed outdoor. Entertainment production, including professional sports, are permitted without live audiences. Some of the things that are continuing to operate that I want to emphasize, one are non-urgent medical and dental care. What we saw in the initial stay-at-home order from March was that people were deferring care for healthcare and for dental, and that impacted their overall health. And want to make sure people are aware that they should continue to maintain their health by seeking care with their medical or dental professionals. Also, childcare and pre-K services are maintained. Schools that are already open are allowed to open for in-person learning, basically falling back to the purple restrictions. Cohort learning is still allowed. The goal is to preserve schools as much as possible, and we're continuing to support schools that are open and providing support and for that infrastructure. Other items that continue to, sectors that continue to operate include critical infrastructure, as I mentioned, defined by the state. Essentially, this background that I have here really says it all. Please stay home as much as possible. We know this is a tough time, and we're all tired, but we are once again in a very critical time in our community where the amount of disease circulating in our community is one that is quite worrisome, and we need to do more than we've had to do in the past in terms of staying home and restricting our exposures with other people outside of our household. I can talk a little bit about Golden Gate Fields. As many of us know, there is a large outbreak at Golden Gate Fields. At this point, there are over 300 individuals that have tested positive there. We continue to work with Golden Gate Fields and the employees there. We have taken swift action there with both the Golden Gate Fields facility, as well as the trainers and staff that work at the facility. We have moved all the folks that are positive off-site, and those that are susceptible that were living on the premises are also off-site, so that they are safely able to quarantine for the 14 days that they're required to quarantine. We have continued doing what's called, it's really not surveillance testing at this point because we know there's a large outbreak there. So we're doing routine testing with the facility for all those there, over 500 individuals. This is part of universal and regular testing that is required of the facility to undergo. And we're doing that regularly with the facility. We've also required them to institute other measures to limit the spread, which includes placement of portable bathrooms and hand washing stations. And there are individuals that are still susceptible that are allowed to work because they're considered essential individuals or essential workers to maintain the well-being of the horses. And those individuals are allowed to return for a limited amount of time to care for the horses. And they have to access the area using personal protective equipment, fit tested N95 respirators, eye protection. And once they finish their task with maintaining the health care of the horses, they are required to leave the premises. So the investigation continues. We are working with California Department of Public Health, Cal OSHA, which is Occupational Safe and Hazards Authority, and California Department of Food and Agriculture, because they are providing consultation on the equine health. So we continue to work with them and to ensure our goal of making sure that the members of our community are protected and continue to remain protected there on that site. On a happier note, we know that vaccine is on its way. We're expecting as a state to receive over 300,000 doses, first of the Pfizer vaccine. That should happen soon. I say mid-December, but we are at the 10th of December. So that means as soon as next week, we hope to get vaccine in the state, with another round coming a few weeks later. In Berkeley, we are anticipating just under 1,000 doses, which is going to go to our acute healthcare facility, Alta Bates. We are following the state and federal guidelines for distribution of that vaccine. And the guidelines include prioritizing healthcare workers at healthcare facilities who are at highest risk for infection. After that, we will continue to follow the guidelines of the state and federal authorities in terms of disseminating the vaccine. Until vaccine is more broadly available, we continue to ask people to, and even one vaccine is available, daily habits still will be important. Washing your hands, staying home when you're sick, covering your cough, and wearing face coverings. I will stop there because I know there's a number of other questions that might help cover some of the other information that I could present. So thank you very much, Mr. Mayor, for your time and leadership in this unprecedented time.
Thank you so much, Dr. Hernandez, for that update and for your leadership. You know, we would be in far worse shape as a community if it weren't for all your efforts to take early action, and to help with regional coordination on our regional response to this crisis. So thank you so much for all that you've done to protect our community. And I'm now going to go to our city manager, and I want to take this opportunity to thank her as well for her leadership of the city organization during this unprecedented public health crisis. And Madam City Manager, do you have an update on city operations this evening?
Yes, thank you, Mr. Mayor. I just want to focus this evening on just three key priorities, and just to share, and specifically around COVID. So number one, homelessness has been one of our top priorities during this pandemic. I just want to share with the Berkeley community that we are very much engaged in finding solutions for a outdoor shelter and possibly an indoor shelter. We believe we're getting very close to landing a resource for our community, further resources, because we currently have a number of resources open, especially homeless shelters during the cold and wet season. At this time, I don't have a designated location to share with you all, but I want you to know that we are making tremendous progress in this area. We're also starting back up this week in terms of our wellness checks with the community, our unhoused community. As Dr. Hernandez has shared, we are certainly seeing a rise in COVID positive cases, and that goes as well for our workforce. So where we started out with 0 cases within our workforce, we are seeing cases in our workforce, and some of those cases are coming from, families that live outside of Berkeley, but it still affects the employees that serve our community. So we're being very cautious and safe around making sure that our buildings and the conditions within our city offices are safe for employees. A huge majority of them are still working from home and telecommuting, and we're going to continue that just so that we have minimal amount of people that are in our workspaces, so that this disease can be curbed as much as we can as workers. It's important for us to continue our day-to-day operations for our community. We're still out there, our police, fire, our waste management workers, our health workers, they are still on the front lines every day working. And so we want them to be safe as well. So we encourage our community to observe the December 7th through January 4th stay-at-home order, because it's very important for all of us to continue to do basic things like provide services to all of you. We are still working with, of course, Lifelong, BATS, and our Dorothy Day Housing to coordinate all of our shelter services and outreach to our community. That's still happening. Our showers are still open. We have 2 shelters that are open full-time here in the city to support our unhoused community. And those are important resources for people, because we're asking our homeless community to stay sheltered in place as well. We continue to go through our neighborhoods, trying to work with our community members that are unhoused to make sure that they are observing as many of our rules as we can, so that they can still shelter in place, but yet keep our community and their areas clean and accessible for all of our communities to access. Lastly, in terms of responding to this pandemic, it is still a top priority for us as a city. We continue to make sure that what we're doing and communicating to the public is both effective and accurate. And so I'm very pleased with the work that we're doing as a city in making sure that we communicate to all of you. And to check out our website, visit us, and look on the city's webpage to access information. Do it regularly, every day if you want to. Go on, take a look at what's happening, what the numbers are showing, and stay informed. The last thing, Mr. Mayor, and I know we've got a lot of questions, and I think Dr. Hernandez has done a great job addressing a lot of our questions for tonight, but the last thing I want to share is that when people say we're in this together, it's starting to sound like an old cliche, and it's starting to make people feel as if, well, we've been together, nothing's changed. It's working. What they're doing, what you're doing out there and staying safe and observing the rules, please continue. We want to provide great, good service to all of you. And if our workforce can't provide those services to you, like our public safety, our firefighters, our police services, we want to be there to support all of you and keep you safe. So please help keep us safe. And I just want to encourage you to keep up what you're doing and make sure that you wear a mask and observe your social distancing. Thank you.
Thank you so much, Madam City Manager. Dr. Varhus, anything you'd like to add?
Yes, thank you, Mr. Mayor, and thank you, Madam City Manager and Dr. Hernandez. I just want to add, as the Director of Health, Housing, and Community Services, we know that what we are asking, or what essentially we're telling people to do, is hard. I know there are many parents of young children that have been in this with their kids at home for the last 9 months. I know that the holidays are coming up and people want to see family. They want to be through this. I also know that we're sensing a light at the end of the tunnel with the vaccine. And it just feels like this last push feels unfair. But I just really want to say that we, as Madam City Manager said, we are in this together, but we really are a community that is really beginning to see that light. And if we could just hang on to ensure that anybody who needs care with COVID can receive that care, we're there for you. And also just kindness toward each other, compassion toward each other. We will look back on this one day. It is not easy what we were asking, but we promise that we believe that it is the very best that we can do together for our city, and that there is a light at the end of the tunnel.
Thank you so very much. Okay, we want to turn to your questions now, and there are kind of two sets of questions. Some are around city operations and enforcement, and some are health-specific questions that I'd like to direct to Dr. Hernandez, or if Dr. Varhus has any additional information she'd like to share with respect to those questions, we greatly appreciate her assistance. So the first question is around the issue of childcare and distance learning. So the question is, how does expecting essential workers and frontline workers to find solutions on their own childcare and education in order to enable them to provide a public service serve the principle of equity? And I'll kind of preface that by saying that, one of my main concerns about the sheltering in place of the past 9 months is it's had a disproportionate impact on low-income families and kids of color. And we already know before the pandemic that we had a growing opportunity gap in our community, an achievement gap in our schools. And I fear that gap is going to widen even more after this pandemic, and the long-term impacts of kids not socializing and not getting the support that they need. There are also issues around internet access, which also impact students' participation. All these things will have a negative impact on the development of our young people. And so once we get out of this pandemic, it is going to be our responsibility to support our kids and to also recommit ourselves to address that digital divide. Let me end this call. Madam City Manager, or Dr. Varhus, anything you'd like to add around the issues around equity and access to childcare and distance learning for essential workers?
I think you made that point very well, and we are very concerned about these inequities around, just the reality that we have a lot of essential workers that are people of color that are showing up from work every day in community. So this is just about keeping them and their children and families safe as well. And I think that we're going to have a lot of work to do when we're rebuilding together to really look at how we can really address these inequities that have happened and create sort of long-term strategies for really addressing them up front, not just returning to business as usual.
Mr. Mayor, I just want to add that absolutely the inequities are real. The impacts are extremely real. I have a 15-year-old student, and the lack of social engagement, requiring that he observe these rules and make sure that he is safe and our family is safe. It has been the most impactful thing for our children, and watching them go through it is painful. And it is something that as parents, we have to figure out different ways to be creative for them so that they stay connected with their spirituality, connected with their emotional intelligence, and try and stay just kind of in a good space in their head. And it's hard. So my hat's off to all of our parents and community members out there that are at home struggling with their youth to gain some form of reality for them to keep moving forward. So I'm encouraged, but it is scary. So hang in there is what I would say to those parents. Find time for your children, seek counseling if you need it. Ask for help from family members to conversate. Use Zoom, even though that's part of the problem for some of our youth. But anyway, I just wanted to share that from a personal perspective, that it is real and it's happening, and we're having to be creative as parents to find solutions.
And I appreciate you sharing that, Madam City Manager. I think it just highlights some of the challenges that families are experiencing. And no, it's not equitable. We know that that COVID-19 has impacted people throughout our country in an inequitable way. And I think that's just an example of broader systemic racism and lack of access to healthcare, which promote inequities that make people more susceptible to COVID-19. And we're very committed as a city to address inequities in health and in education and in opportunity. And I think it's going to be even more important that we recommit ourselves after this pandemic. So thank you to the resident for that question. There was a question around city enforcement. This resident asked, this week I saw a group of kids playing at Cedar Rose Park. None of the kids or their nannies were wearing masks or social distancing. Why can't there be more enforcement? Madam City Manager, maybe you can talk about when do we enforce and what should people do when they see a violation of the health order, the masking order?
Thank you, Mr. Mayor. This is truly a challenging issue for us. Our primary focus has been education, of course. We've tried to be patient and compassionate with folks. We know it's been hard. But in addition to the many public messages that are out there, we've put up signs throughout the parks. We put them in English and in Spanish, trying to remind people of the rules. Throughout the pandemic, we've done everything from board up our basketball rims, take down tennis nets, taped off playgrounds. We put hundreds of signs in the parks reminding people to mask and be socially distant. As we've seen the conditions ease, spike back up, come up, go down, we put tennis nets up for single tennis so that we could allow people access to do things safely. And we didn't reboard the hoops that had boards taken off. Most people have been very respectful of the health officer's orders, yes, but as you've seen, some are not. So more strict enforcement has been focused on what I would call indoor gatherings, where the risk of the virus transmission is higher than outdoors. We've had one code enforcement officer focused on enforcement, and they are reassigning other part-time code enforcement officers from their current duties to also enforce. Now, if you continue to see these activities happening in your parks, in your neighborhoods, please call 311 or email the COVID-19 at cityofberkeley.info. Again, that's COVID-19 at cityofberkeley.info. That's an inbox so that you can report health order violations. Other than that, we are pleading with our Berkeley community to please observe the health officer's orders. This is serious, and it is important that you observe these rules and keep us all safe. Again, you can call 311 or email COVID-19 at cityofberkeley.info.
Thank you very much. There was a question around and I don't know if this is a requirement or this is just a practice, but around whether grocery stores are required to have special hours for seniors and other vulnerable populations to shop. Dr. Hernandez, you're shaking your head that they are. This resident noted that the manager at Trader Joe's said there was priority hours at 8 on Wednesdays and Sundays, but they also let other individuals in at that time. And it doesn't seem like they're keeping to the idea of special hours for seniors. And there's a concern about the safety of having non-seniors shop during those very specific hours. So sounds like there is a requirement that they have to have specific hours.
Yes, Mayor Arreguin, they do. There isn't specific detail as to how many hours or what days or any of those detail, but it is specified in the state order and our order that you have to have specific hours for seniors and those at higher risk. Again, as Madam City Manager mentioned, if there are specific concerns, the best is to alert us through 311 or the COVID-19 email so we can address that through our code enforcement.
Thank you very much.
Mm-hmm.
There was a question about parking enforcement. I know that early on in the pandemic, we weren't doing street sweeping and citing people, and we weren't actually doing meter enforcement, and we did resume that. And this resident is asking, now that we're in a sort of a second stay-at-home order, is the city considering suspending certain parking enforcement during this period of time, given that people should not be leaving their homes on a regular basis?
Thank you, Mr. Mayor, and thank you to the citizen for this question. So yes, COVID-19 has forced the city to really balance competing priorities when it comes to quality of life, public health, and environmental compliance. In the first few months of the pandemic, we did suspend enforcement of RPP, certain meters, street cleaning enforcement as our city and employers and community wrestled with how to resume essential activities. It was new to us. We wrestled with it on how to do this in a safe manner. The data suggests that compared to the early months, our city has seen more movement of vehicles and use of parking spots within the city. With that increased use, however, the city restored its programs and has basically experienced continued growth in parking occupancies throughout the fall and this winter. So while we're not prepared to suspend our current programs, it is clearly something that I will keep tabs on and reevaluate as the full effect of this recent surge becomes clearer. So I do think the submittal of this question, it is something that we'll continue to look at as a city, but at this time, we're not prepared to suspend our current programs.
Okay, thank you very much, Madam City Manager, for that information. Dr. Hernandez, there were a number of public health related questions. Some of them relate to the health order and some just sort of broader questions around the city's coordination with, say, all debates or testing, contact tracing. So the first question is around Alta Bates. This resident's asking, what's happening with Alta Bates? Is Sutter operating a COVID floor or unit? Is it in Berkeley or Oakland? Are they adding bed capacity? And is anyone in the city coordinating with Sutter and Alta Bates?
I'll start with the last part of the question and move backward. But if I forget some of the parts of the question, you can remind me if you could. Yes, we coordinate with Alta Bates. We have a section of our Emergency Operations Center called the Med Health Branch, and their primary focus is on medical facilities, supporting medical facilities within our jurisdiction, and then coordinating with the region, specifically Alameda County, so that we're aligned and support those facilities. So our Med Health Branch works with Alta Bates, with our skilled nursing facilities, long-term care, our clinics, and other medical providers throughout the jurisdiction. So we are communicating with Alta Bates. And we work with them on providing any resources that they need that they can't procure within their Sutter network, because there is, as mentioned, a hospital within Alameda County, Sutter Summit, that is part of the same company as Alta Bates. And then there's additional hospitals throughout the region that are also operated by Sutter. So we work with Alta Bates primarily, and they are looking at their bed capacity. Again, as mentioned in my earlier report, the hospitals are in good shape at this point, and part of that was due to instituting the stay-at-home order early, as well as the work that we've been doing with them during COVID and before COVID. So we have an established relationship that we've had pre-COVID times to ensure that whenever we're at a situation like this, that they are supported, we know each other, and we can make sure that things are done. In terms of how they're managing their COVID patients, I would defer to Sutter and Alta Bates specifically to talk about what the details are, whether they have a Sutter, a COVID unit or not within their hospitals. I can tell you that they are seeing COVID patients at both facilities, but I don't know how their floors are arranged, and I don't want to misspeak on how they are arranging the care for the patients, not only in our jurisdiction, but throughout the region.
I have a follow-up question that the resident did not ask, but it did prompt a question, which is, do we know how many ICU beds Alta Bates Ashby campus has?
I could get that for you. I don't know offhand. And some of it is their beds proper.
Yeah.
And then they've also
Dedicated for COVID. Yeah.
Right. And then also some that they've expanded to have if need to surge to a greater capacity.
Got it.
So there's different opportunities for, there's different numbers based on how they're surging and the capacity at the time.
I'm just going to take this opportunity to say that imagine what would happen if we're in a pandemic and we don't have an acute care hospital in Berkeley. And that is a reality if Sutter decides to close the Berkeley hospital. So we are fighting hard to keep our only emergency room and acute care hospital open in Berkeley. But I think this pandemic really highlights the critical need for Berkeley, with the University of California as well, to have its own hospital in our community. So I wanted to address that issue. There was a question around, does the city's contact tracing show evidence that our restaurants with outdoor dining are spreading the virus? And I guess that gets the broader sort of question around why does the latest stay-at-home order restrict outdoor dining? What is the public health basis or precautionary basis for that?
It's a pretty basic answer to this question that that people may not want to hear or would want more. It's basically what we're trying to do is have people stay home as much as possible. So if you're going out to dine, if you're going out to exercise in a gym or in other places where you're mixing with individuals, your risk of getting COVID is increased. So that is the basic evidence behind these orders, is to encourage people to stay home as much as possible. In terms of our contact tracing and what we're doing in terms of looking at our data, we're drilling down to see what's happening not only here in our jurisdiction, but at a state level as well. But the basic fact here, the goal of this order is essentially to have people not expose each other in any setting, whether, as I mentioned, in dining or any other type of activity. So that's the basic goal with this order.
And I'll take this opportunity to ask a sort of a secondary question that was asked around, is there a sort of estimated timeline about when the city may decide to allow outdoor dining? I know that as noted in your background, the stay-at-home order ends on January 4th, although based on where we're at on before January 4th, there may be a decision to extend the duration of that order.
Right, and I'll add that it may not be my decision as a local health officer to make. If the state imposes the stay-at-home order, it will be up to what the state is allowing. What I have the ability to do is to be more restrictive. I cannot be more lenient than what the state is allowing. And at this point, the stay-at-home order does not allow outdoor dining at all. And I believe we'll be in that stay-at-home order by the state standards very soon.
I'd like to also, and I'd like to add to that, Mayor. As Dr. Hernandez showed in the spike, and we noticed the timeline of what happened as we're post-Thanksgiving, we are also now approaching the other winter holidays, Hanukkah, Christmas, Kwanzaa, where those are precious holidays for many people. And so a lot really depends on our ability to do as much diligence as we possibly can to stay home. As Dr. Hernandez's background says, save lives, because we could very easily see the same surge that we're seeing on top of a surge. And so it's a particularly volatile time as we're transitioning into hopefully better days. So if we just hang in there, the better we do now, the more likely we can open things up later down the road.
Thank you. There was a question, Dr. Hernandez, about demographics, which I found actually very interesting. It noted that Alameda County was reporting zip code specific demographics showing that Latinos in the 94710 zip code were disproportionately contracting COVID-19, and those case rates were increasing. But the county is, according to this resident, discontinued the release of that information. So the question was, is the city of Berkeley considering releasing zip code level demographic case counts so that the community can see how COVID is being distributed in our community and the sort of disproportionality of who's contracting it, the trends of who's contracting. I know I think it's like a 30 to 50 is the highest, and Latino, and literally I'm in that demographic, interestingly, based on when I last saw the dashboards. Those were where the most disproportionate number of cases were.
So we're working to get more data up on the website as soon as possible. So we have plans to update that hopefully in the next month or two, definitely by next year, to be able to show more information. In terms of, and we're phasing in the data that we're gonna be able to display. We don't have the zip code data on our queue, but we'll work with Alameda County to see what the change was in terms of their data presentation. But yeah, we're tracking it, and we are continue to see that that risk group being the group that we're seeing the highest rates of COVID, though it's broadening to other groups as well, in terms of Caucasian and a little older group. So we're still seeing that, but hopefully we'll have more data on our website as soon as possible.
Well, I mean, once again, it's not surprising given comorbidities and propensity for underlying health conditions like asthma and diabetes.
Yes.
So I mean, there's a definite nexus between health disparities and who's contracting COVID-19. And sadly, that is the case in our community as well. There were a few questions, Dr. Hernandez, that you may have seen them around sort of distributing food to other people. Is it safe to share food that's reheated? Can you give food to your neighbors? When you do does the cook have to wear a mask and wash hands? So I guess there are a few questions on sort of delivering or distributing food to your neighbors during this stay-at-home order.
It was great to see those questions because it kind of exemplifies the community here in Berkeley. I wish my neighbor gave me something, but honestly, it really is definitely great to see that. In terms of guidance, I think the best, there are two things I would say in terms of food preparation and then in terms of delivery. So in terms of food preparation, it's always best that you, no matter whether it's pre-COVID or non-COVID disease transmission that we're trying to preserve, keeping your hands washed, especially not touching your eyes and your mouth when you're preparing the food, when you're transferring it to the serving dish or what have you. If you can wear a face covering while you're preparing the food for others, that would be great. Even though you're preparing this in your household, reheating helps, but the most thing is the preparation of that individual in terms of hand hygiene and covering their face and nose. In terms of delivery, it's best if you deliver and leave it at their doorstep, make sure they know it's there and that it's coming so that the food is not outdoors for too long without being refrigerated or heated or whatever is appropriate for the type of food it is. So I think it's safe to do. There are certain measures that you have to do that are above what you might do in non-COVID times, but I definitely encourage that you do that safely. And again, thank you for that question. It's truly a Berkeley question, and I appreciate it.
I agree. There are a few questions about Golden Gate Fields, and I know you addressed this previously in your earlier comments. There was a question around, are we doing surveillance testing among congregate living situations at Golden Gate Fields? And then there was a question as to when the city was first informed of lack of compliance with health requirements. I don't know if you can address that at this time as the investigation's ongoing. And some information is sort of protected under HIPAA, but whatever information you would like to share with respect to those two questions.
Sure. So in terms of testing, as I mentioned earlier, we're doing ongoing testing because this is an active outbreak. So this is what would fall into response testing because we are continuing to see if there's ongoing transmission in that setting. So that's where we are. We're doing regular testing with the facility to ensure that those that still are not COVID positive are tested, and those that become positive are then able to isolate safely. So that we continue. We learned of some of the challenges at Golden Gate Fields as we were doing the investigation of the cases. So, and continued, we instituted the universal testing on our own. It was not a requirement because of an outbreak or state requirement. We did it as soon as we realized that there was ongoing transmission beyond a certain living area. So those are, and then we continue to do more work with the facility to make sure that there was a safer work site for all those that work and live there.
I'd like to add to that because I'm sorry, Mr.
Dr.
Mayor.
Varghese.
Dr. Hernandez is being extremely humble around all of the incredible work that our team has actually done around Golden Gate Fields. They have been extremely sharp. You know, they acted fast to get everybody tested. We leveraged resources from the state, from Alameda County. We really advocated strong for the workers there to make sure that they had opportunity, that they were all safely quarantining those who were positive or isolated, that they were receiving regular meals. And as part of our sort of broader equity strategy, like our primary focus was on getting those workers safe situations as quickly as possible. They worked, you know, over long weekends, and we will continue to be monitoring, supporting, educating, providing information for as long as this pandemic exists. But the disease containment team did incredible work there in a really difficult situation, and I'm incredibly proud of them.
Thank you very much for really acknowledging the work our staff have done to address this outbreak and to protect the residents at Golden Gate Fields and the workers. I think it's important people know what the work that we've done to respond to this public health crisis. So thank you for sharing that. There was a specific question about house cleaners. Are house cleaners allowed to come to your home, even if they live in a different county? I guess it gets to the question is, are they in a critical infrastructure? I don't know if the state has provided any clarity on that.
I was going to look to see if there's specific guidance on that, and I would have to see if anything has changed on the state. I can let you know. This again falls into that category of mixing of households that don't know if this person was a live-in person and was considered part of your household, then that would be considered complying with our stay-at-home order. That said, I haven't seen that housekeepers are part of the critical infrastructure, but I would have to circle back to see if that was the case. There are clarifications that are occurring daily by the state, and that one I haven't had a chance to see if there's been any changes on that. So the person who's asking should go to the state website and see what they're advising as well.
Thank you very much. A question around face coverings. I know this is something we've discussed previously, but does a person have to wear a face covering when they're jogging or biking and maintaining a distance of 6 feet or more from others?
The state now is requiring that people, whenever they're outside, wear a face covering. So if we're looking at the letter of the law from the state, I believe that it's required.
Yes. And you can wear a face covering and ride a bike. I've done that recently. And I think on that basis, I think it's important that people wear the face covering properly, and have the right necessary face coverings to ensure proper ventilation, so that if people are not too much ventilation, but some breathing, so that if people are jogging or biking, that they're able to get proper airflows. So
right, and nowadays there are better face coverings around. That there are some that I forget that I have them on. I don't run, but I do walk fast sometimes, and I sometimes don't realize they're on. So I think that's the other thing, is that there has been additional technology for these face coverings, so they're able to be used in settings of exercise.
thank you. I'm going to kind of rapid fire just a few questions. So question around socially distanced outdoor music lessons are prohibited. Are they prohibited? So that's one question. They're not allowed. So this resident had stated that it's their understanding that parks in the city and county are closed. And I know that the state did and the city did recently enable playgrounds to reopen. And I wasn't I wasn't aware that parks were closed. I believe they're open.
They are open, and as you mentioned, Mr. Mayor, we clarified and made sure people were aware that for the city, and it's consistent with Alameda County, that all the courts are open. Basketball, volleyball, tennis, and pickleball courts are open for household use. So if you are playing any of those sports with your household members, you have access to those, the playing fields as well. So, and the parks are. Basically, the goal is to, as city manager mentioned earlier, outdoor activities are safer, and we want to balance people's mental health by allowing them to be able to utilize some of the recreation activity. So they remain open.
Are dog parks open?
Yes.
Okay. So dog parks are open, but you have to practice physical distancing and wear a face covering, correct?
Yes.
Okay. It's a question about schools. Other jurisdictions have opened up their schools. Why isn't Berkeley? There's a concern about the impact on the mental health and education of students. What are the timelines? That's a good question for the school district. As I noted, we're going to have a special school district town hall soon. Stay tuned for the date. So I know we got a lot of questions around the timeline for BSD reopening, but I don't know, Dr. Varhus or Dr. Hernandez, is there anything else you'd like to add? I know the district's still developing its plans, and obviously the current stay-at-home order is certainly something to factor in, and how to balance safety with a timeline and plan for reopening.
Yeah, so I mean, it's very challenging for all public school districts in California to really balance reopening and safety issues. We have been providing guidance and consultation to the school district on a weekly basis since, oh gosh, I think since the spring. There are a variety of issues involved. We will continue to provide whatever supports we can provide to support their ability to reopen. And back in October, we did lift the shelter in place for schools. And unfortunately, with the new regional shelter in place, it's only the schools that have been, that have taken steps to open that are allowed to stay open. I will say, though, that BUSD did implement these smaller cohorts as a pilot at several sites, and those have continued to operate. And so that is a positive step that they've been able to take that some other districts have not been able to take. So we do applaud that. But going back to what Madam City Manager said earlier, this is hard for our children. We know it is hard and will have lasting impacts. And so, schools that haven't yet reopened should really use this time to put together that reopening plan. We provide a weekly learning community to support that, and we'll provide ongoing consultation. And so to the extent that we will support it, it is our top priority to get kids back in school. We need to support the district's ability to be able to do that.
Thank you so very much. There's a number of questions around socialization. So one question is, the governor has stated that people should ski, but ski and snowboard, but aren't residents not allowed to travel outside of their county of origin and leave their home? It's an interesting question. Seems a little hypocritical.
It's also an interesting question from an equity standpoint.
Yeah.
Like some of us aren't going.
Yeah.
We're not close enough to the snow.
Yeah.
I mean, so you can ski or snowboard, but only your pod, right? But you shouldn't leave your county of origin. So it doesn't, I don't see how you can go to Tahoe when you're not supposed to leave your home or your county of origin. Are both those?
Hopefully the folks in Truckee are getting a lot of ski time in.
Yeah, I mean, are both those correct, that the governor said you can do it, but you can't leave your county and your home?
The order basically says that you should only travel for essential reasons, and to stay within your county or your jurisdiction as much as possible. So that's what I'll say. For us, we would not be able to travel to Tahoe to ski or wherever people ski. I grew up on the beach, so it's really hard for me to understand skiing. But again, I can't go to the beach, nor can I go skiing if I wanted to, because right now we have to stay as close to home or at home as much as possible.
But you can go to a city park.
Yes, you can.
Madam City Manager, you were going to add something.
Thank you, Mr. Mayor. I was, it was back on the schools piece. I was just going to encourage folks to visit Berkeley Public Schools website. They have a elementary school reopening readiness. It's kind of a dashboard where people can see all of the work that's been done, where it's been supported by the City of Berkeley, but they have completed a number of work around their facilities, health practices, their school campus logistics, everything from arrival and departure procedures for the kids. It's a lot of work to get this lifted. So people need to dive into this information so they understand what it's going to take for a high school as large as 3,000 plus students, and all of these things need to be completed and in place for them as well. So it's a huge undertaking. I just want to encourage folks to visit the school district's website and take a look at their dashboard.
Thank you very much for that additional information. We encourage parents to check out that information. There were a number of questions, Dr. Hernandez. I don't know if I'm going to be able to ask all of them, but the underlying sort of question is, can you socialize with people outside of your household? And if so, can you do so outdoors? Can you implement learning pods in private homes? Can you take a walk with another person who is not in your household if you're socially distanced? I think a lot of residents have questions around, under the stay-at-home order, am I only limited to stay within my household, or can I walk with a friend, meet with a friend outside if it's outside, I'm physically distanced, play sports with a friend? So I think that encompasses the various questions that we had received around the issue of pods and socialization under the order.
I did it again. So in terms of gathering with individuals outside of your household, at this point, it is not something that we're able to do. Again, we're at a point in our pandemic where we are at a level of disease that is the highest it's been in the city of Berkeley. It's the highest it's been in Alameda County and throughout the state. And we're seeing the impacts, not only in increase of cases and hospitalizations, but in terms of our ICU. And we are at a point where some hospitals don't have beds for people that need it. So we are asking for individuals to do even more than they did just a week ago in terms of trying to avoid exposures outside of our household. So it is a really tough place for us to be in, and a really tough request for the community to comply with. But really, none of those things are allowed. In terms of support for children in learning pods, at this point, we are not encouraging that. Cohorts at schools are still allowed by following the guidance of the state for the industry guidance. As Dr. Varhus mentioned, we continue to provide support to schools, whether it's BUSD or to the other schools in our jurisdiction, so that they can provide as much in-person instruction and support to our children, because that definitely is our priority as a city, as well as a state, in terms of trying to have these activities and enrichment opportunities for our children. But outside of those activities, we are not encouraging mixing of others outside of your household.
Thank you so much. I mean, that I'm sure is one of the most challenging things around this recent stay-at-home order. It's not just staying at home, but it's also not being able to see family members, friends, and particularly during the holiday season. We know this is difficult, but the goal is to make sure that people aren't spreading COVID-19. So there are a few questions around testing. I took a test through Curative last week. It took more than 73 hours to get my results. It was closer to 90 hours. What will be done to ensure we get back to 24-hour results? I know that Curative is really busy right now. Not just are they were doing testing for the school district, but also they fill up quick. And I think they put their appointments online on Saturday, and they fill up rapidly. So if people want to sign up, you need to go on Saturday and sign up as quickly as possible. But when I've gone there, there's always been a long line. So I'm sure that has impacted their test processing time. But I don't know if Dr. Vargas, you have any other information to share on that.
So once their testing day ends, they ship their test to their lab, which is in Southern California.
Yeah.
And every once in a while, there's a glitch with FedEx, and that delays the results by a day. So that may have been what happened in this case. I also want to add, we actually doubled our testing capacity in the city of Berkeley over the last 2 weeks. The Optum test site, which is at Oregon Street and Martin Luther King, can now take double the capacity. So they can test about, I think their capacity is 330 tests a day. So that's another place if people are unable to get an appointment with Curative. The Optum site, I sent my own nephew there earlier this week, is another option that people can get into, and they often will take walk-ups if they have capacity. And then in addition, we are hopeful that we will be getting a new testing bus in partnership with Alameda County, where we'll be able to do testing events, and we will be doing them in neighborhoods that are have higher levels of COVID as an equity response. And so we're hoping to get that up and running in the next couple of weeks. And so, and also, I just want to reiterate what the mayor said, is that it is true that typically they do open Curative appointments on Saturday evenings. They open them for 7 days at a time, and then they'll reopen them the following week. So try Optum, try Curative. There are also, Alameda County actually has several testing sites that are also free and accessible to Berkeley residents. I have neighbors that got tested. I live in Contra Costa County. There are plenty of testing sites there. So testing is getting increasingly available. And while we have a stay-at-home order and it needs to be followed, I will add that the capacity, there have been many, many people seeking tests out in the last few weeks. And so that may also be, as you said, Mr. Mayor, playing a role in the timeliness of returns.
Thank you so very much. Couple of questions around vaccines. You had touched upon this, Dr. Hernandez, that the first wave of vaccines consistent with the state and federal plan for vaccine issuance will be prioritized for frontline medical personnel. And then my understanding is that the second sort of wave are going to be people with, seniors and other people who are at high risk. And then later in the spring, I don't know if the date's been set yet by the state. There'll be a more broadly available distribution of vaccines. So in answer to that question, that is my understanding of the progression of vaccine availability. You're shaking your head. And I know there's a lot of discussions happening right now. I read an article in the New York Times this Sunday, about sort of phase 1B and who are you prioritizing? Are you going to prioritize other essential workers? Or are you going to prioritize seniors and people with who are higher risk? And those are the kinds of decisions that CDC is making right now that have, my understanding, have yet to be resolved. So there's still information that's being developed. I know the state has its own vaccine plan the governor announced recently. So that's my understanding of the progression, but there's still more information and decision making that's being happening. I don't know if Dr. Hernandez, anything else you want to add on the sort of the phasing?
That's your description, Mr. Mayor, is absolutely correct. This is the broad phasing that the federal government is agreeing to, and then the state will also follow that and then modify as they can if needed. And yes, those discussions continue. What also continues is the availability of vaccine. So we now know we have the Pfizer vaccine, we have the Moderna vaccine that we're hopeful will get approval soon. And as more vaccine becomes available, if additional vaccine is available, then those decisions that will change some because we'll have more availability. So fortunately, we're at a point where we're able to have these discussions so we can have people vaccinated. Of course, the decision to vaccinate healthcare workers at highest risk of getting COVID is to preserve our workforce, our healthcare workforce, so that if and when we need to seek care, there is someone there to take care of us, because we are seeing healthcare workers also be part of the case counts that we're seeing, because the disease is that prevalent. So the goal is first to make sure that we have a healthcare workforce to protect us in hospitals, and then going out from there.
Thank you. There's a question: if someone had contracted and recovered from COVID-19, is it still recommended that they get the vaccine, or are they immune? My recommendation: you get the vaccine, because even if you have a vaccine, there still is a very small chance that you could get COVID-19. And the vaccine is only for a certain period of time, right? It only provides, depending on the vaccine, coverage for a certain period of time. It may be that we have to do this on an annual basis in order to stay vaccinated, because it's anticipated COVID's going to be with us for quite some time.
Yes, and I would also say that we're not sure how long immunity lasts for natural disease as well. So even though you might have gotten the disease earlier in the pandemic, the recommendation at this point is to get vaccinated. Of course, speak with your healthcare provider if you have specific questions based on your personal health, but at this point, that is the recommendation.
There was a question around one member of the household being over 65, the other 63. Can they both get the vaccine? I think these are the kinds of decisions that are being made right now in terms of the next phases of vaccine availability and who will be prioritized. I don't know if we can answer that question specifically at this time, but information will be available soon as to the next wave of vaccine distribution and who is eligible and who will be prioritized. But stay tuned. And once again, there's light at the end of the tunnel. We're talking months now, not years. So I think it's important for our community to understand. And that's why it's so critical that we stay vigilant and that we get through this next month. There was a question on vitamin D, and I know this because I actually take vitamin D supplements. So a lot of doctors are telling the patients to increase their vitamin D supplements, that they can help address more severe COVID symptoms. Have you looked at recent analysis of studies that show strong preventative effect? And if so, why is this advice not included in public statements?
So I will say that I have to do a little more digging on that research. And it is not something that broadly in public health that we're recommending. That said, I will have to look and see what the research shows. And again, if that's something that you've had recommended by your provider, then I would follow their recommendation. I do want to say one thing unrelated to this question, but something that I do, again, happy to hear is that there's so many questions about vaccine. And the underlying question that I'm hearing is, when can I get vaccinated? So again, that is great to hear, that people are wanting to get vaccinated, understand the importance of being on that prevention side of the disease as opposed to not. So I want to say that that's really, really important to hear. And as you mentioned, Mr. Mayor, we are talking months, not years. And that's the other piece that we have to look at, is that it's coming. There are still things that we'll have to do. This is going to be a tough time, but there's hope. And that's what gets most of us, I will speak for myself, keeps me going, is having hope. So I just wanted to share that and thank the community for continuing to have hope here.
With that, I want to share two messages. One, mask on to move on. Remember to wear your face covering if you are leaving your house for essential business. And I want to thank the city of Berkeley for helping distribute the posters, and we have banners on major thoroughfares in the city of Berkeley. This is really critical. If you do have to leave your home, to wear a face covering is critical. I want to give our city leaders an opportunity to say a few words, and then I have a video I want to play as we close out. So, Madam City Manager, any final words to the Berkeley community?
Just very briefly, Mr. Mayor, stay vigilant, take care of yourselves so we can be around longer for our children and our families. As Dr. Varhu said earlier, this is hard. It's hard and tough. You can do this. Please stay vigilant. Thank you.
Thank you. Dr. Varhus, any final thoughts you'd like to share with the Berkeley community tonight?
Yeah, so just adding to what Madam City Manager said, and I'll share what I told our staff this week, and that is, this Christmas might feel small, it might feel challenging, it might feel like we can't see the people we wanted to see, but you know what we can do? We can, and I'm sorry, Christmas, Hanukkah, Kwanzaa, whatever you celebrate, whatever you do in December to nourish yourself and your family, it might feel small. It might feel like not enough, but do you know what you can do this year? You can dream big for next year. And let's just hold on to next year's dream and start to think about how we're all going to be. Where are we going to be this time next year? And let's just dream about that together and keep as many of us alive as possible in that time.
Thank you so much. Dr. Hernandez, any final comments you'd like to share with the Berkeley community this evening?
I can't say any more. I think what Dr. Varhus, how she summed it up, is definitely how I would ask the community to continue to dream and stay home and wash your hands. I have to put in the plug as a physician to say stay home as much as possible and take care. And thank you again for all that the community has done to stay as safe as possible.
And I just once again take this opportunity to thank you. I can't imagine how difficult these last 9-10 months have been. And you've literally saved lives, and our community is deeply appreciative of your leadership. So with that, I want to share one final message before we close out, and stay tuned for information on the next town hall. So let me share screen here. And 1 second. Okay. Forgive the technical difficulties. And And I think that message really hit the message home. We all need to do our part. We need to do our part to save lives, to help us safely reopen our economy, and to get us through the next. Forgive me. YouTube is still playing. Let me close this. So just as I said, we have to do our part to save lives, to help reopen our economy, to get us through this year. There's a light at the end of the tunnel. We know a vaccine is on the horizon. Berkeley, I know this is difficult. This is difficult for everyone. We have made enormous sacrifices this year, but let's do our part these next few weeks, and we'll have a brighter 2021. So with that, thank you to our city leaders for joining us today. Thank you to the Berkeley community for tuning in, and please stay safe and healthy.